inside your bedroom. We stopped counting the days, lost in the rhythm. Physical silence, no need to speak a word.
And I would like to point out again, the reason we're using Chinese to share our story is because we have the same problem as we hear a legal document or a personal story from English. That is not our native language. So that is the main conflict. We want everyone to feel us and to empathize with us. Again, thank you all for patiently listening, and thank you, Lulu, so much for sharing that story. And with that, let's actually move into the next section of our data, which is community resources. And with this section of data, we have an overall rating of 3.75, which is even lower than before. And the first questions we have, what are your common ways to receive mental health information among the AAPI communities? And we can see that the WeChat, which is a social media platform we use, just as Instagram or Twitter, are the top one choice for AAPI community members to receive their information. And the second high would be Zoom meetings or other social medias like Twitter or Instagram or Facebook. And we're also using Flyer and emails a lot. So this is a way we can see the difference already between the way of us receiving information between American citizens. And also the next one has like, how well do you use your local community mental health resources? How well do you use those classes and trainings or support groups that might can help you? And 64% of the respondents number was 0 and 3. They have almost no use at all on those community mental health resources. And that is a big gap that we're having it and where we expect it. And besides that, what is your experiences? Even if you're using those resources, what are some language and cultural responsive you have while contacting local community services? And again, 56% of the respondents received, no, I'm not having any language or cultural responses. I cannot talk to a person who knows Chinese. I cannot relate to someone who have a Chinese background. And that is still a very big difference that are happening right now in our county. And I do want to leave more time with the healthcare. And in this section, we only have an average score of 4.89. And the first question we have is, how difficult was it for you to find a doctor of Asian background? We're talking about the real hospitalized, like, for example, if you go to the Kaiser or if you go to the John Muir Hospital, we were able to find a Chinese doctor with an Asian background, with the same knowledge and the same language with you. And 50% of the respondents received was a 0 to 3. It is almost impossible to find a doctor with the same background. And only 20% of people say, yes, it was easy for me. And even if somehow you can find an Asian doctor, or even if you're trying to use a mental health care system, but how about the conveniency? And we can see in this question, how convenient is for you to use the mental health healthcare system? And again, 52% of respondents respond with a score of 0 to 3. This thing is very inconvenient. There are so much barriers and trouble are hiding in the path of their ways to seeking mental health healthcare system. And one more thing is to cover in the healthcare system is the insurance. So here's a question asking, how well does the insurance cover mental health area and topic? And the score varies a lot. But there's one more potential question that are hiding within this question. Even if somehow your insurance covers those topics, but because all of those lengthy documents and all of those description of insurance, it is very hard for us to know, hey, what is my insurance cover? It's very hard for us to familiar with those things. And 0 to 3, and 33% in the questionnaire respond with a score from 0 to 3. They think there's little to no transparency in the insurance description. Again, this is only a small area of topic of question we covered due to time limit, but I still want to give more time to our valuable respondent, which is Yvonne. To you, Yvonne.
Hi, everyone. Before I start my sharing, I want to emphasize why I finally decided to share in Chinese. Even though I'm perfectly capable for using English, the language barrier is something that all immigrants are bound to face. And now you're sitting here with live caption, with translated piece of the stories, and even though having a wonderful live interpreter here. But all these are things that immigrants don't have when they are looking for medical resource. So here's my story. So, 在这里我想先给大家分享一个非常重要的文件，它现在正在我们的 PowerPoint 上面。这是一份简体中文的保险细则，就像现在屏幕前的你一样，很多曾经像我妈咪好友 Sophia 阿姨这样的第一代移民，盯着这些晦涩生僻的词汇也会一样一头雾水。我们与 Sophia 阿姨认识是在一个非常美丽安全的城市 Brentwood。我和 Sophia 阿姨都非常喜欢这个美丽的平原，它与车水马龙的城市被一座座山坡隔开。每到了秋天，山坡之上的金色麦浪都会如同汗血饱满的光滑皮毛一般闪闪发光。Sophia 阿姨的丈夫会载着我们跑这段山路，唱着歌享受这段美丽的景色。而这一切都暂停在 Sophia 的丈夫检查出心理健康疾病的那一刻。Sophia 阿姨和她的丈夫在美国生活了很长的一段时间，他们的语言足以应付所有的日常交流。然而，当面临医学方面的问题时，Sophia 阿姨和她的丈夫必须到有中文医生的医院就诊，而离他们最近的符合条件的医院在 Fremont。这段美丽的山路却成为了除开他和他爱人疾病之间最大的烦恼，因为从 Brentwood 到 Fremont 不仅有2个小时的车程，而且这段山路也有长达1个小时左右。由于 Sophia 的丈夫主动承担了家中开车的工作，这种曾经的恩爱与保护让 Sophia 阿姨即使持有驾照，也并没有开过如此危险的路段。但是丈夫的治疗在即，她鼓起勇气，有惊无险地开到了位于 Fremont 的诊所。她在日后回忆起这段1个多小时的山路，还心有余悸。然而可惜的是，直至今日 Sophia 阿姨和她的丈夫仍在与精神健康疾病抗争，当然也在与这一段不长不短的危险的山路抗争。虽然 Sophia 和她的丈夫看似能够解决这个问题，但不如让我们回到故事的开头。如果 Sophia 可以选择一份更好的保险，如果她的丈夫居住的地方拥有中文医疗资源，就能够让她的丈夫在家附近获得精神健康治疗资源。更不用说在针对这种问题时，很多的保险并不会 cover 或不会与受保人强调有关精神健康的 plan。且精神健康治疗在很大程度上依赖文化背景共情以及更为流畅的交流。我们每一位语言不通的移民都会像一座孤岛，而目前这种不完善的医疗体系更是消除了所有在孤岛与孤岛之间建立桥梁的可能。语言的不同导致了保险计划以及保险公司的选择困难，这种困难很大程度上加剧了语言不通者不能够得到他们需要服务的可能性。他们并非不愿意融入美国，而是美国连在生命保障问题上都给予了他们过高的门槛。谢谢各位来聆听我们的声音和担忧。我们亚裔模范少数群体将不再沉默。谢谢。
谢谢伊文。伊文 just shared a story of Sophia and her husband, who are close family friends of hers. Due to the language barrier, they encountered a difficulty in accessing care that is convenient for them. Even calls to attention of language barrier for non-English speaking consumers in terms of fully understand a health plan coverage and how to access the best and the most convenient care. Leo, back to you.
Thank you, Lydia, and thank you, Yvonne, for your valuable share. And now I'm gonna move on to the next sharing, since we do have more stories that are regarding on the healthcare problem. And to you, Edward.
你好，我是来自 Contra Costa County 的 Edward Wang， 我是 NAMI Contra Costa 的成员。NAMI Contra Costa 是美国最大的基层心理健康组织，全国精神疾病联盟的一部分。我同时也是作为一位曾经受到精神健康困扰的青少年朋友来进行今天的分享。感谢你对心理健康服务的支持。在疫情的时候，美国的大学停止了线下教学。我这位朋友也只能在家里上课。他平时是自己一个人在外面租房子住。 而疫情也让他非常害怕出门，担心自己会感染上病毒。由于他的许多朋友都在国内，他和朋友的聊天也非常有限。在学业压力和对病毒的恐惧下，他几乎失去了对于吃饭的欲望，整天过得浑浑噩噩的，曾一度想要自杀。他担心家里人担心，所以也没有和他的父母讲自己的情况。直到他真的对生活失去了希望，再也撑不下去的时候，他也找了几位美国当地的心理医生，而父母在这时候才知道他的病已经那么严重了。尽管英语沟通不存在问题，但他似乎很难与说英文的心理医生进行深入的交流。也因为他在早期的时候并没有接受到一些可以聊天的同辈的建议，才导致他一直拖到严重的地步才接受治疗。在我的推荐下，他找到一位会说中文的心理医生，但这不是美国当地的资源。在和这位说中文、有着中国文化背景的医生进行心理治疗后，他一步一步重拾了对于生活的希望，而我也为他的改变感到骄傲。他的故事说明了许多的青少年在病情的早期并不会急切寻求帮助，而只是当疾病蔓延到危害自己生命的时候，才会去寻找帮助。而那些没有找到帮助的，就有可能自杀而结束生命。而在当中文作为患者更熟悉的语言时，有一位会说中文的心理咨询师和同辈能够最大的帮助患者。所以，我衷心的希望政府能够用一部分钱来支持同辈计划，让这些患者或潜在的患者在早期就能够获得他们同辈的关怀和建议，这样能够更好的帮助到这些早期和潜在的患者，并且资助一些有中文文化背景和会说中文的心理咨询师，能够更好的帮助那些患者从心理健康问题中走出来。这些钱也可以让一些心理领域的专家走进校园，让更多学生了解到青少年心理健康问题和如何帮助支持那些有着心理健康困扰的人。谢谢您抽出时间听我的故事，我可以指望您保护心理健康服务，并给家庭带来康复的希望吗？
谢谢 Edward. Edward just shared a story of his friend who suffered social isolation and depression during the COVID pandemic, lacking peer support and having difficulty connecting with an English-speaking psychologist made the situation worse. Edward emphasized the importance of early prevention. Edward advocates for more government funding to help establish peer-to-peer support groups and provide scholarships for the training of bilingual and bicultural counselors. Leo, back to you.
Thank you so much, Lydia and Edward, for your sharing. And due to time limit, I'm going to move on a bit faster. And here's our public safety section. And this section has an overall rating of 3.59. And the first we have is, how do you feel about the impact of COVID on the safe Asian American community? Since we do see a large scale of sorry, I think my Zoom just froze for a second, but I will restart sharing right now. And the first question we have is, how do you feel about the impact of COVID on overall safety on Asian American community? And we can see that 60% of the respondents has responded with a great impact. They're feeling threat in our community right now because of the COVID impact and some misinterpretation and miscorrection about the Asian virus. And since then, they are still living in the fear. And next question we have is, what do you think the government is how it's doing to stop anti-Asian hatred based on that Chinese virus and all of those hatred and racism that are going inside our country right now? And 64 of the respondents, 67% has responded with not specific action. They feel like there's not enough action or solution government has provided to stop those anti-Asian hatred. And since we're already going around time, and I'm going to share just a little short sentence about those public safety areas. And as a Chinese immigrant, I really feel sometimes threatened just by viewing those online social media platform, or even just walking down the street. I'm afraid that someone would like rob me or like shout in my face, "Hey, go back to your country." And that is not something I'm supposed to feel. I should be able to feel safety in this country. I love the land. I love the people here. And that is why we should definitely see those voices and actually make some change.
Inside your bedroom.